The Intercept broke a really important healthcare story here that demonstrates exactly how politics really works in America. So they explain, just hours before House Speaker Paul Ryan held a press conference to sell his healthcare overhaul legislation using a PowerPoint presentation mocked for misrepresenting basic facts, he was doing something he's much better at, fundraising. The two things were related. The Thursday morning breakfast fundraiser he attended was hosted by a lobbying firm working to unwind the Affordable Care Act on behalf of health insurance company Blue Cross Blue Shield, one of the big winners of Ryan's proposed legislation. The breakfast, according to an invitation, was sponsored by McGuire Woods PAC, the political action committee for the lobbying firm McGuire Woods. Blue Cross Blue Shield pays McGuire Woods $120,000 a year to lobby on changes to health reform, records show. Attendees of the event were asked to pitch in as much as $10,000. The AHCA includes a special 30% premium surcharge insurers can charge anyone who has gone without health coverage for at least 2 months. The bill also reduces the types of medical coverage Medicaid policies are required to cover, the type of flexibility insurers have sought in order to cover less health care costs. Okay, so in other words, Paul Ryan met with private health insurance companies at a lobbying event, and then he went on to give a presentation on health insurance and health care in America, where the bill is a massive giveaway to those industries, or to that industry, I should say, to those companies. This is how politics really functions. So think about that. I actually didn't know that provision until I read this article, that in this GOP Obamacare replacement bill, there's a 30% premium surcharge that insurers can charge anyone who has gone without health coverage for at least 2 months. Whoa. So remember, one of the scandals over Obamacare was, hey, he's mandating, the government is mandating that you have to have health insurance. And oh my God, they'll fine you if you don't get it. And people went, that's the individual mandate I don't agree with because it's forcing people to buy something from the private market, and that's not cool. But there's a dirty little secret about the individual mandate, which is it had no teeth. So in other words, they say, there's a fine, but there's no enforcement mechanism for the fine. So if you actually don't buy health insurance, you really don't get no penalty. There's no penalty. So they say there is, but if there's no enforcement mechanism, then there's no penalty. So think about that. They're saying we mandate you get health insurance, but it's really a bluff because they have no way to enforce it. Now, with Paul Ryan's bill, it's actually more of an individual mandate because it's saying, no, there is going to be an enforcement mechanism, and it's not by the government. The enforcement mechanism is by the private insurance companies who are going to charge you a 30% surcharge, up to a 30% surcharge, if you go a few months without getting health insurance. So there is an enforcement mechanism in this, and it's by the health insurance companies. So if you buy insurance from them, they make money because you're buying insurance from them. If you don't buy insurance from them, and then eventually you buy insurance from them, they make even more money from you because they'll charge you whatever your premium is, plus whatever the percentage for the surcharge is for that individual company. So it's a win-win for them, which is why they're for this bill, and Ryan is pushing this bill, and you're the ones that are going to end up getting screwed over. So if you hated the individual mandate, which by the way was my least favorite provision in Obamacare, but if you hated the individual mandate, you should really hate this because this is a real individual mandate, and you don't even have the money going to the government, which can then be used for roads and bridges and things that make sense. No, it goes directly to the private health insurance companies. So they price gouge you if you buy from them in general, because there's a profit margin and because they try to wiggle their way out of care, so on and so forth. And they price gouge you if you don't go with insurance, then you eventually get it. So this is just wins all around. This is a giant giveaway, an even bigger giveaway than Obamacare was to the private health insurance companies. That's what this is. And look, this is what it all comes down to. It all comes down to the fact that the private health insurance companies pay the politicians, so the politicians do the bidding of the private health insurance companies. You would think, if he really is this, libertarian-like Ayn Rand-loving conservative, then his position on health insurance should be clear. I want it to be totally privatized, totally free market, but if you don't get it, that's your choice. There's no penalty. That's what a natural libertarian would say. I don't believe in a single-payer system. I don't believe in a Medicare for all system, a government system. I want the government to have nothing to do with healthcare. But if you choose not to get health insurance, that's your choice. That's this is personal responsibility and individual freedom and liberty. He said, no, fuck the principles I say I believe in. I'm a corporatist. That's what Paul Ryan is. I'm a corporatist through and through. So I was bribed by the private health insurance companies. Now we're going to craft a bill that it's a win-win for them and a lose-lose for you. And let me be so brazen to go to a fucking get-together with them, a fundraising event, a lobbyist event beforehand, before I give a speech pretending my Obamacare replacement bill is for the people. No, it's for the people you just met with and did a circle jerk with. That's pretty clear.